Are you a nurse that looking for a perfect pain reliever, or a doctor looking for the right prescription to prescribe for your patient for pain and also fever? Are you a nursing student who struggle with frequent mild headaches while studying for your nursing exam? Well, I have that perfect medication for you. Today, we're going to be talking about acetaminophen, also known as Tylenol. So here I'm holding Tylenol. I'm going to discuss what this medication is for. This medication helps to reduce pain and also fever. This medication comes in different forms. You can take this medication orally, intravenously, and rectally as well. It is important that patients understand that there are different forms of this medication and different prescriptions as well. So, an infant will have to take their infant Tylenol, child Tylenol, and adult Tylenol. So it's important that doctors and nurses reinforce the education, what prescription and what medication that they can take. Let's discuss about the side effects of this medication. This medication can cause nausea, vomiting, and upset stomach. So it's important for nurses and healthcare providers to ensure to reinforce this education that clients are aware of this side effect that is common. Next, we're going to discuss the adverse effects. The adverse effects of this medication can be liver toxicity. How can this happen? Well, a patient who takes excessive amount of this medication is at a risk of having liver toxicity. Not only that, nurses and doctors need to ensure that they have a full assessment on the patient. That is because if the patient is taking 3 or more drinks of alcohol, this puts them at a higher risk of liver toxicity. It is important that we teach the client to reduce their alcoholic intake just so that we can avoid this complication. Now, what is the dosage of this medication? Well, it's important that the clients are prescribed 325 to 600 milligrams every 6 hours, and this is for adults and children. Not only that, this is again an antiparesic medication. It's going to help reduce that fever, and it's a non-opioid as well. Analgesics. So let's be ensured that reinforced education. This is a pain reliever and a fever reliever as well. It is important that again the clients understand that there can also be allergic reactions, such as rash, sore throat that can be swollen mouth, the eyes, and face. They have to discontinue this medication and report this to their healthcare provider and their nurse. Again, it's important that the nurses and doctors get a full assessment of their patient to understand that this can cause liver toxicity. Again, if you're having headaches, fever, or any type of pain, acetaminophen is the job for you. Again, let's go out and teach our nurses, our doctors, and patients how to take this medication. Thank you. Acetaminophen. This headache just won't go away. I'm so glad I learned about Tylenol. This is the right prescription. My doctor said take 1 as needed.